Is Maine's rise in COVID-19 cases linked to face mask use? No, that is misleading. A social media post showed a newspaper article claiming that the surge in coronavirus cases in Maine were the result of Governor Janet Mills' mandate for citizens of the New England state to wear face masks. The claim uses statistics from a CDC-published study that showed people who said they wore masks contracted COVID-19, but there was no evidence that the masks caused their infections. One of the authors of the study has said, "We are not aware of any of our data showing that wearing a mask increases the risk for COVID-19. The CDC has updated recommendations that state masks prevent the spread of COVID-19. The claim appeared as a post, published on Facebook on December 5, 2020, under the title, "Maine's Rise in COVID-19 Cases Linked to Face Masks." It opened, quote, "The recent rise in COVID-19 cases in Maine could be linked to prolonged use of face masks by the general public." End quote. This is what the post looked like on Facebook at the time of writing. Source: Facebook screenshot taken on Monday, December 7, 22 hours 58 minutes and 17 seconds 2020 UTC. The article in the Facebook post was published by the Fort Fairfield Journal. The Fort Fairfield Journal article cites a Centers for Disease Control and Prevention study published in the CDC's Morbidity and Mortality Weekly Report (MMWR) on September 11, 2020, titled, "Community and Close Contact Exposures Associated with COVID-19 Among Symptomatic Adults as Greater Than or Equal to 18 Years in 11 Outpatient Health Care Facilities, United States, July 2020. Health Feedback, a nonpartisan, nonprofit organization science education group recruits experts to review science journalism and scientific journal articles. Health Feedback said previous social media and news reports using that study to make a case against face masks are flawed in their reasoning and are misleading. From Health Feedback, quote, "Flawed reasoning. The comparison made in the claim cannot evaluate mask effectiveness in reducing the spread of COVID-19, because the study that the claim is based on included many more people who wear masks than people who didn't. Of the 314 individuals surveyed in the study, only 11 never wore masks. Because the group sizes are so uneven, a comparison of the proportion of people who tested positive for COVID-19 who wore masks and who didn't would show mask wearers to be the majority." End quote. There is no evidence that prolonged face mask use increases risk of catching respiratory illness. Below is the graphic the Fort Fairfield Journal article cited for the claim there was a 20 times greater chance of catching COVID-19 with prolonged wearing a face mask when compared to those who never wore a face mask. There is nothing in the study or in the graphic that shows there was a greater chance of catching COVID-19. The people in the study who were positive case patients reported that they wore masks for 14 days before the illness onset. There is nothing that states the masks gave them a greater chance of catching COVID-19. Wesley Self, associate professor at Vanderbilt University School of Medicine and one of the authors on the CDC study, told Health Feedback, "We are not aware of any of our data showing that wearing a mask increases the risk for COVID-19. According to its website, the Fort Fairfield Journal is not a Bangor Daily News publication. The Fort Fairfield Journal is the only independently owned newspaper in northern Maine and is the only local newspaper in Aroostook County that is still being printed in northern Maine." The Fort Fairfield article, which refers to Maine's governor as Janet Big Sister Mills, claims, quote, "The recent rise in COVID-19 cases in Maine could be linked to prolonged use of face masks by the general public. Scientific data collected in randomized controlled trials over the past 60 years has consistently shown that the use of face masks to stop respiratory viruses is not only ineffective, face masks may also cause an increase in respiratory illnesses such as influenza and COVID-19. A more recent study conducted by the U.S. CDC's COVID-19 response team and published in the CDC's Morbidity and Mortality Weekly Report showed that there is a 20 times greater chance of catching COVID-19 with prolonged wearing a face mask when compared to those who never wore a face mask. In that CDC study, it was found that of the 154 new cases of COVID-19, where patients had both a positive PCR test for the purported virus RNA particle and real symptoms, around 85% reported they wore a face mask often, or always, up to 14 days prior to symptom onset. The control group in that study also showed symptoms of some sort of respiratory illness, but had a negative COVID-19 PCR test. In the control group, 88% of the people reported often or always wear a face mask.